In 2012, we started the Healthy Choices program at Alfred Health. This was based on the Victorian Government's Healthy Choices Food and Drink Guidelines for Victorian public hospitals. These guidelines use a green, amber and red traffic light classification system. We built relationships with 4 on-site retail outlets, redesigned our menus with support from dietitians, altered food and drink placement to favour healthier options, increased prices of some red foods and drinks, and adjusted serving sizes where appropriate. We worked with our vending machine supplier to adjust contractual obligations and meet our targets. Alfred Health became the first health service to exceed the benchmarks outlined in the government's guidelines.
Look, it's a great initiative between us and the Alfred Hospital, and we're very proud to be a part of it, making a small step in a big journey for healthy choices.
Yeah, look, I think nutrition and the food that we eat and the drinks that we consume have a huge impact on our overall health, and a massive part of the health problems that people face today are preventable. We can make some of these changes that will lead to long-term impacts for the population.
Alfred Health recognises that catering for meetings and events is an important consideration of any workplace. So we appointed a panel of approved caterers and created a policy that no red foods or drinks were to be included in catering.
It's really important that we're ambitious in the way that we're approaching obesity. So what we decided to do was to approach our catering to address this as well, so that we can provide healthy options for staff.
Alfred Health conducted 4 trials with red drinks. In each trial, there was no change in total sales, but people shifted towards healthier drinks. We removed red drinks from display at the main fully serviced cafe and from self-service refrigerators at another on-site cafe. We also increased the price of red drinks at the on-site convenience store, as well as in our vending machines. The result? More than 2 years later, the cafes and vending machines have maintained the changes to the red drinks. There was also no significant difference in total drink sales, with fewer red drinks sold at the Alfred each year. To help customers notice the traffic light ratings of foods, we created nudge cards and posters. We then tracked how this influenced their decisions by observing lunchtime food purchases and surveying customers. While customers continued to purchase meals at the same rate, there was an increase in green meals, an increase in amber meals, and a decrease in red meals purchased. This equates to around 30,000 fewer red lunches every year for just one of our cafes. 3/4 of customers noticed the traffic light labels, with 77% of these customers saying it influenced their meal choice. Total food sales did not change, however, keeping our retailer happy.
I often feel like something sweet in the afternoon, and it's a really nice option when I come down and I can look at it and rethink what I'm going to buy and think, oh, maybe I should get something a little bit healthier today.
I think it's fantastic that people who come here can have that choice to eat healthy, and again that it's very heavily advertised and clear to them the decisions they're making.
Yeah, it's a great initiative. I think it definitely makes you second guess what you're buying, and I think it's great for the patients and the visitors as well to have that guide as well.
The hospital, it's often perceived as somewhere where we only treat illnesses, but having the healthy options there is a great way to show the community that we are also about prevention too.
Like all health services, we're there for people when they get affected by illness, disease and injury, when things go wrong for them. But these days we're trying to be much more than that. We're very keen to help people make the healthier choices for them. So our work has received a lot of interest locally as well as internationally. Lots of other settings are very keen to learn from our experiences that we're keen to share.